You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You and Your Young Child has been brought to you in part by Minor Family Dentistry and by the Sternberg Museum of Natural History. Minor Family Dentistry would like to bring you the following dental health tip. It's recommended to have a dental checkup no later than your child's first birthday. An adult should brush for a young child and monitor older children's brushing to ensure a good job is done. Flossing should start when teeth are touching. Minor Family Dentistry wishes you good dental health. Families, including children of all ages, are welcome. Minor Family Dentistry, 1010 Downing and Hayes. Find them in the Next Tech directory.
So, you think you have skeletons in your closet? Come to Sternberg Museum, where we let our skeletons out of the closet.
Hello, and welcome to You and Your Young Child, the program devoted to early childhood. My name is Dana Stanton, and I'm the coordinator of the West Central Kansas Smart Start Grant. And with me today is Beth Fisher. Good morning, Beth.
Good morning, Dana.
Now, first of all, tell us what organization you work with and what do you do there?
I work with the Hayes Area Children's Center, and I am a registered nurse there.
Okay. Now, today we're going to talk about vision screenings, and the vision screenings for children, correct?
That's right.
Okay. Now, why is it important to get a child's vision tested?
Well, children use their vision a lot to learn. Over 80% of the things that a child has to learn comes associated with their vision status. So really, good eyesight is very important for learning. And it's estimated that 1 in 4 children experiences a vision problem. And that figures out to about 2.4 million children in the United States that have a vision problem identified. If they're not identified early, Dana, then they can also cause some disabilities and even blindness. So it's really important to get their problems figured out and diagnosed, yes. And, you know, some of the treatments that can be done by the vision professionals, optometrists or ophthalmologists, can be as simple as putting glasses on them or a patching treatment system or something like that that would maybe stall or limit the problem.
And I imagine fixing a problem before it got to be a bigger problem when they're older.
That's right.
Yes.
So, you know, and most of this has to be treated or should be treated before the child reaches the age of 8.
Now, is there a certain age, you know, I think probably not a newborn, but maybe so. What age should a child's vision first be tested or screened?
I can start screening a child at very, very shortly after their birth. The testing is pretty limited at that point, but there's certain things that you can look at that could indicate a problem.
Now, how would you do that? Say you have a baby. How do you test a baby's vision?
Well, I look at the appearances of their eyes. I have a nice little list that's been developed at the state. You look at, you know, if their eyes are the same size, if they're nice and level, if there's a lot of mattering or redness, that kind of thing. You look at their pupils and make sure that their pupils are equal in size and that they react nicely to light and that kind of stuff.
Now, are there some other signals that maybe a parent might be looking for that would maybe give a red flag that their child might have a vision problem?
Yeah, there's some behaviors that children can exhibit, you know, like if they're not making eye contact, especially in very young children. That's one of the first things that you look at. But also, like when the parent moves through the room, if the child follows that movement through the room and that kind of thing. As the child gets older, then there's other behaviors that you can look at, is like holding things unusually close to their eyes, rubbing their eyes a lot, turning or tilting their head, squinting, you know, if they're looking at something in the distance or they don't notice things in the distance, or if they turn or tilt their head funny when they're looking at something, something like that.
Now, vision acuity, I know, how early can that be measured?
children's vision changes very rapidly the first 6 months, and so I start checking their acuity at about 6 months of age.
Now, I know you brought some things, so can you show us how to do that?
Yes, I have what they call teller acuity cards, and these are cards that have been researched extensively, and it's called preferential looking, but on each card, and this is a very large grid, but each card has a grading, and so then when you present this to a child at a certain distance, a testing distance, then their eyes will turn to look at that grading. This is a very high one, and it goes then all the way down to a less until they cannot see it anymore. So that's how you can get an estimate of how well they are seeing.
Now, are there other tests that you can do for maybe a little older child?
I also do fixation and tracking because we want to make sure that the child is able to fixate on things like books as they get older, faces, objects, things like that. Tracking, we move the object and watch their eye movements and try to make sure that movement is very nice and smooth. One of the appearances that can indicate a problem is some where you see some little fluttery movements when their eyes move. So that's another thing that you can look at.
Now, I want to know about the orange sunglasses and the butterfly.
Okay, then we have what we call fusion, which looks at if you close one eye or close the other eye, you have a different vision in each eye, and so this tests to make sure that the child is not seeing double. So that's stereo, called fusion, so that both individual images get fused into one image. And then this is some fancy little 3D sunglasses, like what you would get at a movie theater, and you can test depth perception with this 3D picture then. And so that's that. And then I also have a way to test on children that are older. They can trace, this is color vision. So we can see if they have any color deficiencies there.
Now, say someone is thinking, I really need to get my child's vision screened. Would they need to contact you, or how does that work?
They can call me at the Hayes Area Children's Center, and the phone number is 785-625-3257. There's a number of different ways that a child can be screened. There's several different programs. There's an Infant C program that is sponsored by the Optometrist Association, and they see children free of charge at 1 year, and it's a free screening for their vision there. There's also a free screening, same type of program with the optometrists. There's several in the area that do this, and this is at age 3. It's called See to Learn, and it's a free screening for children at 3. If you want more information on those programs, you can call me, and we'll get that phone number to you. Also, we have a monthly screening. It's called the Hayes Interagency Coordinating Council screening, in which this vision screening is part of. And during those screenings, then we do hearing as well as the child's development. So it's a good all-round screening.
And I know my kids have done, all 3 of my kids did that, and it's very, very helpful information for parents.
Yes, it is. And that's monthly. So, and we can screen children birth to when they enter school at that point.
Well, thank you so much for that wonderful information.
Oh, you're welcome.
You've been watching You and Your Young Child, the program devoted to early childhood. Parents, remember, you are your child's first and best teacher. Thank you.
Thanks for watching You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You can watch the program weekdays in the noon and 9 o'clock hours. You and Your Young Child has been brought to you in part by Minor Family Dentistry and by the Sternberg Museum of Natural History.